Hi, I'm the representative of FLUOROQUINOLONES, and today I'll be sharing to you guys fun facts about our drug classification. Under my team, we have ciprofloxacin, venlafaxine, gemifloxacin, levofloxacin, moxifloxacin, norfloxacin, and ofloxacin. Remember the suffix floxacin. Those were just the generic names. The chemical names, they will be shown in the screen. For the brand names, ciprofloxacin is known as Cipro, venlafaxine is Extoro, gemifloxacin is Factiv, levofloxacin is Levakine, moxifloxacin is Avelox or Vigamox, norfloxacin is Noroxin, and ofloxacin is Floxin or Ocuflox. For our drug classification, therapeutically, we are antibiotics. For our pharmacologic classification, we are fluoroquinolones. We belong under the pregnancy category C. For our mechanism of action, we involve interaction with both DNA gyrase, the drug target initially recognized, and topoisomerase 4, the related to topoisomerase 2. In a given bacterium, these two enzymes often differ in their relative sensitivity to us fluoroquinolones, and DNA gyrase is more sensitive to gram-negative bacteria and topoisomerase 4 to gram-positive bacteria. Usually, the most sensitive enzyme is our target. For our pharmacokinetics, peak serum concentrations are observed 60 to 90 minutes after oral administration and 30 minutes after IV administration. We tend to have moderate to excellent bioavailability. Our volume distribution is 1.5 liters per kilogram. We are widely distributed in extracellular and intracellular fluids and are concentrated in the prostate, lungs, and bile. Although we are widely distributed in the body, our ability to penetrate into tissues and bodily fluids depend on the individual drug. Lastly, we cross the placenta and milk. For our metabolism, we are absorbed from the GI tract and metabolized in the liver. Our elimination half-life is 1.5 to 16 hours. Most of us are excreted via the kidneys, but moxifloxacin is eliminated primarily in bile. We are indicated for treating infections caused by susceptible strains of gram-negative bacteria. Here is the list of bacteria included in our scope. These bacteria usually infect the urinary tract, respiratory tract, and the skin. Our member, ciprofloxacin, is effective against typhoid fever and against a wide spectrum of gram-negative bacteria. It has been approved for prevention of anthrax infections in areas that might be exposed to germ warfare. For our contraindications, we are contraindicated to patients with a known allergy to us, of course. We are also contraindicated to pregnant and lactating women, patients with seizures, patients with certain disorders that may lead to arrhythmias, and patients who use drugs that are known to prolong the QT interval or to cause bradycardia. Okay, for our side and adverse effects. In the central nervous system, we may cause mild headache, drowsiness, insomnia, dizziness, or mood alteration. In the muscular system, we may cause torn tendon, muscle pain or weakness, and joint swelling. For the senses, we may cause problems with vision and hearing and altered taste and smell. In the digestive system, we may cause abdominal pain or discomfort, diarrhea or constipation, vomiting, and nausea. In the cardiovascular system, we may cause arrhythmia. For the nursing responsibilities, before administration, the nurse should assess for possible contraindications and cautions. The nurse should also perform physical assessment to establish baseline data. Next, they should examine the patient's skin for any rash or lesions to identify possible adverse effects to the drugs. Perform culture and sensitivity tests at the site of infection to ensure appropriate use of the drug. Lastly, they should provide patient education and advise the patient to avoid medications containing calcium, aluminum, iron, or zinc as it may impair absorption. During administration, the nurse should make sure that the patient receives the exact dose of the drug as prescribed. Next, they should give plenty of fluids. Provide small, frequent meals as tolerated, and ice chips or sugarless candy to suck if the patient is experiencing dry mouth. Restrict caffeine due to its effects to the CNS. After administration, the nurse should monitor the patient's response to the drug. There must be a resolution of the bacterial infection. Next, monitor for adverse effects. Check the effect on the patient's GI tract, patient's photosensitivity and orientation, and affect. Lastly, monitor patient's safety measure and compliance to the drug therapy. That would be all. Again, we are fluoroquinolones, and I hope you learned something today.